So then I thought maybe we could start with, like based on your experience, since you have done both, I guess more traditional therapy and the equine work, if you could maybe just tell us how you see those two things as different.
hmm Yeah, sure. So I specialize in mental health treatment as a clinician. My licensure is a LMFT in Oregon, which stands for Licensed Marriage and Family Therapist. And I also have my doctorate in PhD in transpersonal psychology. And the PhD was the merging of the two, like traditional into the equine assisted services and mental health world. For traditional counseling, well, I'll just say this, I'll start backwards a little bit because the main difference between integrating horses in mental health treatment compared to traditional counseling is two main differences. One, there's an equine, which can be a horse, donkey, or a mule. So all the equids count. Although we mostly say horses because they're the most common, and it's outdoors. It's like the two main differences. Other than that, practitioners, mental health practitioners can, or even equine assisted learning coaches and practitioners can integrate anything from traditional counseling into the world of treatment and mental health care. It's just how it's adapted to make it work. When it comes to like the equine therapy part of it, there are certain modalities that have come in to really influence it. And some of those equine modalities are very specific and like a very specific intervention of how that's done. And then now there's tons of different trainings now and certifications for people that are interested in it that they also have a very like narrow approach to working with it. So it's a little more not necessarily scripted, but there can be very specific guidelines and what you do from beginning to end and that kind of tried and true ways of working with people. And humans have studied human behavior for years and for a long, long time. We've been very interested in our mind and behaviors, and there's been a long history of mental health treatment and changing things up. And so, yes, I'll just say that. And then the other difference I'll say is that traditional mental health practices that have that little more specific modality, and that might be CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, motivational interviewing. Those and then there's also EMDR, which is eye movement, desensitization, and reprocessing. Those are considered in quotes evidence-based because they've had enough research and then a buy-in in the powers that be in the psychology treatment world of the United States, and that transfers to the rest of the world, that these are good and you should do that. The main difference with equine mental health treatment is we do not have any evidence-based modality. And it creates problems because it makes it seem like it's alternative or this other approach or this a CAM approach, which is complementary and alternative medicine approaches. It's not, it's a little more fringe versus these vaccines over here. The other thing too is I think the main difference that humans have in like their psyche, right? They have this very, and this is like part of the stereotype of counseling. And I think this is part of the difficulty and change that needs to happen to integrate the two more appropriately in the science world and in the science plus insurance world to help cover services, essentially, is that humans have this like schema and this like archetype that counseling is done inside while the client is lying on a couch and the therapist is sitting behind them taking notes. That still to this day is like the main thing that comes through. even though in that form of treatment with psychoanalysis, but and it still exists today, and there are practitioners that do that, but that's totally different now. Now we have client-centered treatment approaches that are adaptable. We're looking at clients, we're making eye contact, developing that relationship with them in a non-judgmental way. And those current principles are the same now that we apply with equine-assisted mental health. So I'll pause for a minute. Do you have any questions or want me to clarify anything? And let me know if I'm
that makes a lot of sense, actually. Maybe like as we're talking about this at some point, if you could maybe address just a curiosity that I have is when you have a horse working with you as a partner, what do you think that, or an equine, what do you think that equine can do that the human therapist does not have access to?
Oh, sure. Yeah. The main difference is that it's a non-human. And when a client or a person feels relatively comfortable around a horse, because there can be initial fear and anxiety that can come up for somebody, even if they have horse experience, because counseling can be a provocative experience for people. You know, it can bring stuff up. There's a lot of vulnerability in that, a lot of shame and guilt and needing help and not being able to be self-sufficient in their own healing and recovery process. So when a human being feels relatively comfortable with a horse, we start to form an attachment to them. And we develop a story with them and a narrative with them and an emotional bonding and connection with them. And we start to project, all over them. And so the main difference is they're a horse, not a human, and they're nonverbal, meaning the horse doesn't speak human language. And so it requires a deeper connection and understanding, whether you're learning horse behavior from a practitioner or your own previous knowledge, or in some modalities, it's just whatever the heck you want to say the horse is doing without like specific behavioral intervention. We call that metaphor. And that could be, their own meaning making, and there's some value in that, but there can also be value in a client knowing the proper, what we ascribe to horse behavior, like what they're actually doing. It requires a deeper connection to be able to hear and to listen. And the other thing I'll say too, that is just this incredible phenomenon that is difficult to study, but has been talked a lot about, and that horses, you can't hide who you are around horses. You can't mask it. They sense it like to the core of a human being. And, we have tons of extrapolation and ideas about why, like, oh, this and that, it's because they have a big nervous system, or because of, they're a prey animal and we're a predator on 2 feet with 2 forward eyes. Like there's all sorts of, extrapolation as to why that is. But we don't always have to know the why too. It happens.
Right.
And what that does is that whereas with a human therapist, there's a lot of masking that we do. And humans tend to be, for the most part, very private when they have issues. And we're taught very often, men and women, taught to hide how we really feel about things and to be polite and this and that. And, and then there's a lot of sometimes too much toxic positivity of like, oh, you'll be fine, get better. What doesn't kill you makes you stronger. This too shall pass. Things like that can be helpful and beneficial, but they can also be shame-inducing if that's not enough for somebody. And it takes time to develop trust and rapport in traditional counseling. Because of that masking and because of the vulnerability, and then that slowly can come out, and how that therapeutic relationship and alliance develops from that rapport is versatile in terms of how long it happens and or how quick it can happen. But usually it takes, on average, in traditional counseling, probably 5 to 6 sessions before the client may start to feel the benefit of therapy. They start to feel a little more relaxed with the process, if that makes sense.
Yeah.
When it comes to equine therapy, because horses have the ability to just like stir stuff up, is the rapport can go a lot faster. And that can be a good thing and sometimes a bad thing. And I really mean the second part, because when we are working with clients that are coming in, especially with severe trauma, like PTSD, post-traumatic stress disorder, or really high anxiety, or OCD, or which is obsessive compulsive disorder, any of that stuff, or depression, if we activate stuff too fast and they don't have proper coping yet, it can be really overwhelming. And what helps, I think, with the horses is that if this is happening and they're having this moment, they're like, woof, a lot of times it comes out in tears, crying, just like these big aha moments is what it might look like from a client. Is that if the horse is responding appropriately to that, the horse is staying with them, not leaving them. Hopefully. Like they're there through that process. And because horses usually are big, and you can still work with mini horses, little baby horses that are like so, or baby, but smaller horses that are like the size of a large dog, like the horses can still have that effect on people. But we're assuming for the most part, we're working with little larger horses or ponies, that if the horse is willing to allow this, that because that horse is there and they represent this release in a way, then the human can like hug the horse, or like bury their face in their mane and cry, or like have that relational contact that might feel safer than with a human. Because a lot of humans get embarrassed when we cry, get really embarrassed. Like there's too much self-control that happens sometimes, even in traditional counseling, where people get embarrassed and they stop that process. So if a client is really able to cry in your human presence, they trust you. But with horses, I think we feel like they're non-judgmental, that, their presence means they like me, I'm safe, I'm okay physically, and this release is coming through. So I think if things come up too fast, the horse can be restabilizing in that way. And I think it's also important for practitioners, mental health practitioners in particular, to be trained in crisis response. We call it psychiatric first aid, or like just if stuff comes up too fast, we need to be able to help people re-regulate. So a community of a population community that is well known and very studied quite a lot around treatment with horses, and that's going to be with veterans. Veterans and at-risk youth are two of the most common mental health populations that are studied a lot. And when it comes to, like, I call it military-related PTSD when I wrote about it in my dissertation, is that some of like that experience of their lived experience of PTSD, I mean, it's unique per person, but just quickly generalizing that it can be really, really intense, really intense. And what happens in the military, because of the process of training to become a soldier, regardless of whatever branch you're in of the military, you go to boot camp and you're trained, there does tend to be this desensitization of individualism and rebuilding back up into a group team mentality. And so in a way, they lose themselves.
Yeah, that's interesting.
And they're all about their buddy. Like they don't go anywhere without their buddy, their battle buddy, because of safety, right? And they have to do this process because they have, that person has to be able to take an order to kill somebody if it ever came to that, without question, sometimes. right? Like, I think we've done a little better with ethics and like trying to work with some of that, but still, it's like you're given an order, you're expected to follow it. And if you're doing operations, sometimes it's solo, but most of the time you're in a team. And you train with that team, you sleep with that team, bunk with them. They become your family. And the military concept becomes your community and your world. So we separate these groups by saying military community, civilian community. It's very different. And so when somebody who's in the military develops military-related PTSD, whether it's from actual combat and witnessing horrible things, or their guilt, survivor guilt. And survivor guilt is if their buddy dies in battle and they don't. Or it could be military sexual trauma, sexual assault, which is what I wrote about in my dissertation. It doesn't have to be from combat, but when they develop PTSD, it can be so intense and hard to come back to the self for healing. And there can be a lot more intensity in symptoms. So it requires a lot more care and mindfulness and I think a little more of a gentle approach. And then of course, because many soldiers are badass, they are taught to not feel pain, and to battle through everything. Just put your head down and battle through it, battle through it, battle through it. So they are like experts in masking how they really think and feel. So you may not really know, unless you're really good at observing or whatever, get a feeling, are they really okay? And are they going to be okay? So, and I mentioned this part of it because of just the super activation that horses do, that just has that phenomenon of like opening our hearts and like opening the stuff that comes through. And that release can be pretty powerful. So I'm going to pause a minute though, if I'm not going too off topic. Do you need to clarify anything?
No, that's great. And I think myself, I have been in that situation probably twice unexpectedly, where someone, even though I was doing, the learning piece of it, you just never know what comes up, right? Which is why I got my trauma certification. But, I really can see that aspect of the horse really becoming a regulating mechanism for the person so that they can, regulate down and kind of go into, some kind of homeostasis again. So, yeah,
Yes, if the horse can handle it, like if
right.
the horse is okay.
Yeah.
There are times that we have to separate that, and just to protect the horse and from that kind of energy. And but then we stay, usually with kind of the modality of equine-assisted mental health now is it developed to have like a two practitioner model where there's a mental health professional who's like the main therapist leading it, and then there's equine specialist that helps through with the horse and with safety and all of that. Both of these people can be mental health professionals, doesn't matter. And in some cases, the mental health professional doesn't need to have any horse experience, and the equine person takes up that role, or the other way around. Equine person may not have any mental health experience, and then the mental health person takes that role. Obviously, it would be good for both people to understand mental health and understand equine, so
Right.
that there's better collaboration and better conceptualization of things and response to things. Because the main therapist or the person leading the session needs to know, do we need to cancel the session?
Right.
Like, is this too much? Do we need to pause? Do we need to separate them from the horse temporarily and go for a walk or something like that? Because movement and walking and stuff can help re-regulate the nervous system, bringing them back to grounding, back into their body and all of that. So there are some times that can happen. But that's why I started out with, like, ideally the horse can handle it. They're good. They're like, I've been here, I've done that. They're what I call those crystal horses that can just like take in that energy but then release it. Kind of like how crystals can be used for healing. They're like a solid object that we can use the energy. But then we can also clear the crystals out so that it's not staying. So yeah, so they can be that nice reinforcer of grounding their physical. But I think that idea too, that I'm your buddy, I'm not leaving you. is significant. Big time for veteran stuff with that idea of buddy. So they'll definitely identify with the horse as their battle buddy, or like that's their person, and they care very deeply, very often. From my experience working with veterans, is that they really want to know that horse is okay. So if something ever happens to the horse, it's really important to be honest to a certain degree about what's going on. And then a lot of times, veteran communities want to help, and they want to help muck stalls. They want to care for the horse. They help with barn maintenance. It's part of that idea of like, not just being on the fringe, but being part of the community, and part of that tends to kind of come through too. But of course, every person is different, but just kind of tends to be like a theme that you might see as well.
Yeah, cool. Yeah, I think it happens too in like first responders. My husband retired from LA Fire, and yeah, there is this sense of like his buddies, and even after retirement, they're in touch, and the annual events, and taking care of the widows in the community. And I can definitely see that. Did we go on to question 2?
Sure.
Are there some mental health conditions which, in your experience, respond particularly well to equine-assisted therapy?
Yeah, so as long as there are no contraindications, and I'll come back to that, pretty much anything can be applied and a treatment plan created to help support that person with horses in therapy. Pretty much anything, which is what's so great about even traditional counseling, like that. I mean, they're similar in terms of a mental health practitioner in a traditional setting, like office-based setting. They lead and conduct their sessions and their modality based off their specializations, what they like, and there's so many approaches they can pick from. And then they might specialize in a certain intervention or modality, and with a certain maybe population of people. That same approach can be done with equine-assisted mental health. And very often with equine-assisted mental health, unfortunately, it tends to be like a last effort for people that, in quotes, have failed at a therapy, in quotes, don't respond well to it. This tends to be huge for youth. Youth already don't usually respond well to therapy because they're mandated clients. I have worked with some clients, teen or youth clients that wanted to be there. They like realized they had a problem, and they're like, sure, I'll get this support. I happily take medication. But most of the time, no, and they're like, huh? So, and that can be stressful for both, the parent and the child that are involved in that process. But a lot of kids need support, and they need a community, and they need to help get through the adversity and the difficulties of growing up. So the so I'll start with like what I've worked with. I specialize in treating people with disorders or mental health issues or challenges that are anxiety related, depression or mood disorder related, and or trauma stressor PTSD related. So I call it kind of like the holy triangle. They're the holy trinity of that. And a lot of people have those main three, not everybody, and it may be in varying degrees, but they tend to coexist together. The trauma informs the depression informs the anxiety informs depression informs trauma. So you do tend to see that. So because of that, the clients that I work with tend to respond really well with that. With anxiety, the goal is always to reduce the symptoms. And with depression, it's always increasing mood and stabilization. And then with trauma, it's a lot more complicated, but it's going to be that combo both of like reducing hyperarousal, but increasing sense of self, increasing positivity, increasing healing in order to have, psychological well-being, so to speak. The contraindications to equine-assisted therapy, like the populations that most likely may not be a good fit, would be anyone who has a severe phobia of horses. Like that, I mean, you can do exposure therapy and all of that, but if they really are terrified of horses, it's not going to work.
Right.
And I don't mean to like say, something is how do I say this? Like when I say these things, I don't want it to seem like it's a black and white impossible, but it's just one of the things. Like if they are really that scared of horses and they're not going to be able to relax after 3 or 4 to 5 sessions, like then it's not the appropriate fit. So that's number one. Two is severe allergies to a barn environment, that they will go into like anaphylactic shock or something like that from hay or grass or horses. Like that's not going to work. So those kinds of things are just not going to work. If somebody has a physical ailment or issue where being in an outdoor environment may not be safe, or interacting with horses may not be safe, whether that's unmounted or mounted, which is riding, that all has to be taken into consideration. For my nonprofit, Eudaimonia Equine Connections, Inc., we are a PATH certified center member, and PATH International, which stands for the Professional Association of Therapeutic Horsemanship, has been around since 1969. They specialize in therapeutic riding, which is working with individuals with physical issues usually. And in the 90s, they branched off to also include mental health treatment, like specific social, emotional treatment for things. And they have a really good understanding of like when is it really appropriate for somebody to receive treatment, and when may it be advisable to not. And they have like a list of contraindications that they kind of go over with that. And so because of that, for our nonprofit, we follow their guidelines in terms of their recommendations. So it's not to say somebody with a physical issue can't do it, but we also have to think about like the practicality of things, like because being at a barn environment, and a lot of times practitioners don't have control over the property because they might be leasing it or borrow use of it, and it could be uneven ground, there could be all sorts of stuff. And a lot of people like to work with horses without being on a lead rope. They let the horses be free, and sometimes that could be an issue if something big happens or the horse spooks and you can't get somebody out of the way fast enough. So the other thing I'll say in terms of mental health conditions that would be contraindication would be anybody who has a history of animal abuse and fire setting.
Okay.
I don't think anyone wants pyros or people that do that to be around a barn.
Right.
So, and then with animal abuse, we have to be careful with that. Like, I think sometimes like a unique therapist might want to bring that in as a treatment thing, but we also want to be mindful that our horses are safe and aren't going to be hurt by somebody. And then the last thing I'll say is that we have to be careful. It's not necessarily a hard no. We have to be mindful of working with clients that have psychotic disorders.
Okay.
The main issue with that is if they have a psychotic episode during a session or like right before, we can't really do that to the horses because the horses are so sensitive. And maybe you might have a magical unicorn horse that can do that and it can work with somebody. But the issue with individual who may be genuinely experiencing a psychotic episode, which could come from schizophrenia, could come from a manic episode, can come from borderline personality disorder episodes, like stuff can happen and your brain just goes off. It tends to create dissociation. Sometimes people go into different personality states. They're not aware of what's happening. So therapy is not beneficial at all. Like it's not going to work because they're not there, if that makes sense, until that goes down, whether that goes down with time, just kind of cycle through, and or medication supports is big in helping with that. And sometimes psychiatric hospitalization is required to really help that person come back into their body. So if somebody does have a mental health issue, a genuine psychotic disorder, it doesn't mean they can't participate in equine-assisted mental health. I think they still can. And there have been studies with that, with helping inpatient people or, having that additional support of integrated care when they are released from the hospitals, is like having these other options for healing and connection and all of that. It's just if they have a psychotic episode there during the session, that would be a complete contraindication.
Okay.
And requires very important specialization from the practitioners to be aware of that and how to handle that.
Yeah, that makes sense. I'm just curious in your experience, like, I think a lot of people in modern society just because of the life, that we lead, the lifestyle. There might be some, dissociation from the body, or maybe just some, not the practice there of going into the body and feeling in the body. Or when that happens, it can feel a little unsafe or, uncertain. Do you think that working with the horse that is a nonverbal animal and it's just so physically anchoring, do you think it's helpful for people to slowly begin the process of getting into their bodies?
Absolutely. And this is why horses are really, really good candidates for helping people with trauma or PTSD, because I mean, people can have a panic attack, which is associated with anxiety. A lot of times we have a panic attack and they might dissociate and like, get super dysregulated, but they come back, but it's not really PTSD. Like PTSD is super hyperarousal, and because of something that's happened in the past, and there's a trigger thing that happens, sometimes from the unconscious or just by what's happening, and then it activates the amygdala and those memories. And because our brains store memory in like clusters of information, like if they remember something related to that past negative association, they're going to remember a lot of it, a whole bunch. And it's like it's super overwhelming. So it's like if that does happen, that can lead very quickly to dissociation, which is a smart safety response from our body. Like I think our bodies have incredible ways of coping. Like, yeah, this is happening, fuck that, I'm out. But we don't want that to happen, right? Like, wait, come back. Because it's scary to have that experience, right? It's both like your survival response is this doesn't feel good, let's check out, let's avoid it. But then your ego, your id is like, wait a minute, where do we go? Come back. So it's scary. It's not a fun experience for that, even though it's just a unique adaptive way of handling a stressful issue. So one of the best approaches to working with people with trauma and PTSD is somatic therapies, is mind-body therapy. That helps people connect with their body, because we store much of our emotional memory and experience in our body. And most of us feel emotion here in our chest and our heart area. But if somebody connects with their body through mindfulness, muscle progressive relaxation, like there's so many different ways to help people connect with their body in safe ways, they might experience sensations and emotion in different parts of their body. And the whole point of counseling, whether it's traditional or equine-assisted related ones, is we talk about how do you feel, right? What's the feeling behind that? And the reason why is because we want to connect our mind to our body and how we feel about something to process it. And by processing it through talk therapy, any intervention out there, you're having that emotional release. And if you stay just in the head, like cognitive behavioral therapy is very much in the mind. If it's only there, you cut yourself off from the rest of your body. And it's not a matter of your behavior makes you think how you feel. Like there's not like this certain order of like think. So I have a thought, I have emotional response, and then I have a behavior. It's not that linear. Like it can be all over the place. Maybe I have a response, I have a behavior, and then I think and feel, or I think and feel. It's like all over the place, right? So it would be helpful, I think, for practitioners to be aware of both, how to work with somebody cognitively, but somatically as well.
Right.
That being said, horses are all about somatic. Horses are touchy-feely themselves. They communicate in their herd and their communities through touch constantly. And what I mean by that is like reassurance or hey, or what's up, or go away, or like they're using a lot of their body to communicate. And they can communicate vocally with each other as well, with like neighing and all of that. And so, and same thing with humans. Humans respond a lot to touch. Humans are also very somatic, touchy-feely people, right? In many, many cultures, we hug to say hello, or there's just something there about that contact that happens. And horses usually are big and there's a lot of them. So a lot of space sit that and hang out with them. And then usually with horses, it's hands-on, literally, like you're grooming them, you're haltering them, you're like playing with them, like there's a lot of hands-on stuff that's already happening there. And it's a great way to integrate the body into that. And horses just have such a, similar to how we talked about a little earlier about that phenomenon of just them like being able to activate stuff and kind of bring up this hidden stuff that's been there for a while. They have a way of being able to remind us about our body and like, oh yeah, you are there. And part of that is because horses can be big and they can bump you out of the way or like, nudge you. And like, you have to be aware of your physical body, literally just around horses for safety. And then they just remind you like, oh yeah, I am in my body. Whereas when we talk abstractly sometimes, we just talk and talk and talk and talk and talk, like in traditional therapy, and you don't have something tactilely, like you might get way up here and not stay connected to your body. So horses have that nice reinforcer of that somatic thingy there. So yeah, and then very often the human animal bond that comes from the partnership between a horse and a human usually happens very often from like a working relationship. There's like a point to it. That makes sense. Like, for example, people that ride horses recreationally, there's a point to that, like where you're training them to do something, like jump or do barrel racing or whatever. And like, there's such a somatic connection that comes from that. And with equine psychotherapy or equine-assisted mental health, the focus is technically supposed to be the treatment plan. Like, why is that person coming? What is their goal for themselves, that person? Are they wanting to feel better, right? Reduce anxiety, this and that, feel better kind of thing. We need to be able to pair what their experience is going to be like with the horse, like a treatment plan, to match that. And that is so important to have, because if we don't do that, we can lose focus. And I think it's so important. And I tell this to my intern, because I have a equine-assisted mental health internship program. I have a nonprofit, and where students can come and learn the art of equine-assisted mental health treatment, and they can, take that information and go do whatever they want after that. If they want to stay in the equine world, and then figure out their specializations within that. But what I'm big with them on is that mental health is very goal oriented, and that's okay. Like, it's okay. Like, and I say that because I think in some of the newer equine philosophies, and like the newer, like trying to push back against the paradigm of like old psychology thinking, which is understandable. If we're just wish-washy and kind of all over the place, we're not holding a boundary in a container for that person. And there are legal and ethical requirements that mental health professionals have to keep in mind. And the number one thing is the client benefiting from this therapy? If they're not, then they might need to be referred out, and or discontinuation of services, and or reevaluation of the treatment goal. And the goal can be as long as it needs to be too, lengthwise. Like, I tend to be more of a long-term therapist, so I'm happy to work with clients as long as they need and they're still benefiting from it. Some therapists have a short-term approach, so they work with clients for a short period of time. A lot of the equine-assisted services programs have a shorter model, which is understandable because of the cost and all of that with horses. So they might have like a group for 6 sessions or 10 sessions, or they might have a retreat or something like that. All of that is totally fine and appropriate. And the client is aware of it in the beginning. Like, this is going to be short term. For me, I'm very open-ended unless they have an ending, unless the client needs that for financial reasons, or they just want to go fast or whatever. Yeah, I'm just going to pause for a minute though.
Yeah. So then if I hear you correctly, whether it's a long-term or a shorter-term approach, like whatever that is, that packaging is, it's still important to remain like mindful of outcomes.
Absolutely.
Okay.
Yes.
Yeah.
Yes.
So
And
it doesn't sort of, you know, I can see how that can happen too. Especially, when you're working with horses, the importance of, being mindful of outcomes. Yeah.
Yeah, and I say this with the understanding that there's a lot of pushback with insurance, with healthcare insurance companies that are pretty cruel and unreasonable in a lot of situations. And this comes up big more in traditional counseling because they're more likely to cover that than the equine services, is that they are too much about outcome.
Right.
And that I think creates vicarious trauma for therapists. Like, I'm not good enough. They're not going fast enough. What does this mean? And agencies that most therapists work in agencies, I think, and some might have their own private practice, but agencies provide benefits, consistent income. A lot of people tend to do that. They push back, right? Because they get funding from grants or
Right.
whatever. They get funding from insurance companies and stuff that they contract with, and they have to demonstrate outcome. And some insurance companies are better about it than others, but there's always that threat of an audit that they're going to do an internal review or quality management review or something like that, and they have the right to do that. They can go in there and pull any client's record at any time. And if it doesn't demonstrate this, or the therapist was elaborating too much, it could be considered fraud.
Wow.
So, and then if that were to happen, there's horror stories of this, then the insurance company has the right to redact all the payments they gave to that practitioner. So if they
Wow.
were to go in there and say, oh, they didn't need this treatment, or you could try to fight all of this and appeal all of this, but they've done this to therapists, and then they can go, well, you didn't match our contract, and so now you owe us all of this money. So
Wow.
anyway.
Yeah, that regulatory thing is it's like an albatross, but it is what it is, it's just important to be able to at least begin that process of, integrating the equine work more into mainstream.
Yes, and sorry, I just had an idea too, just to help explain this. It's like the way I look at it is, and I'm a very transpersonal person and transpersonal therapist, which is integrating mind, body, spirit, and recognizing so much influences that are there that hinder and also help.
Mhm.
Is that I think it's helpful to think about the treatment plan as like this river that's meandering
Mhm.
and eventually may reach the ocean. Like, it's just, this is our guide. Like, we have something here with some little boundary, can get waterfalls and this and that, get a little bumpy along the way, but it has kind of like this little purpose to it. And that meandering is where, like, for example, I said I'm a long-term therapist, like, it may take a long time. And if I like the client, it's going well and it's affordable for them and, feels right, that's fine. We'll meander as long as we need to get you to that beautiful ocean, if that makes sense.
Yeah, totally. And and even working outside of the, insurance scheme, maybe one way to, I think it's important to be mindful of, outcomes and, maybe if we don't want to call it outcomes, is the client resourced? After each of those sessions. So yeah, really important. I actually feel the same way about, less regulated stuff like equine-assisted learning because, it's important that the benefit is, you don't lose sight of that sort of, maybe that goal or that benefit that is being sought.
Yeah, and the goal is what will distinguish between equine assisted services in mental health or behavioral health treatment and equine assisted learning. So that's like the main thing that differentiates those two. One, and then two is the certification, credentialing, licensing of the practitioner and what they're doing. So there can be an overlap between the two. And so it's the overlap that can't happen though to the other side is if an EAL or equine-assisted learning practitioner is not a state licensed mental health professional, should not be treating through a psychology treatment approach or clinical counseling approach. If that makes sense, because they don't have the training and the certifications, and that would be illegal practice. But on the other side, the therapists that are state regulated licensure and all of that, they can do both. You can do EAL, this and that. They just have to be clear about the goal, which is the treatment plan. So, and then I'll back up just a little bit too, for anyone who doesn't know what the differences between those two are, is equine-assisted learning is usually centered around education, coaching, are the two main things. And education is the learning part of it, where they could be learning about themselves and have like a pretty deep work, which is why stuff can still come up in an EAL session, even if it's not clinical counseling. It's usually the outcome in a learning thing is that you've learned whatever it is that you wanted to learn. So an equine-assisted learning with education can be used with diversity of population of people, and what that is and what that looks like. When it comes to coaching, equine-assisted learning and coaching is going to use a lot to do with self-development and career development. It tends to be like vocationally focused and empowerment focused and, and all of that. They still overlap though. I think education and coaching kind of overlap, but education usually can be tied to learning a skill, or something like that. And then coaching is, learning about yourself at a deeper level and then go out there and make money or something like that.
Yeah. And those two things really overlap because, if you have a professional, let's say, coming in and you're doing, let's say, sessions with a group focused on leadership styles and, the person that you are obviously is going to show up, So there's so many layers that people can work on, including, communication, interpersonal skills. I mean, it can be such a huge skill building process, and it's just the importance of keeping some level of outcomes in mind, right?
Yeah,
Yeah,
yes. And I think that part is important when it comes to what the participant can expect,
right.
right? Because why else would they be coming, right? I mean, they like horses, right? Horses are a great marketing tool. Yeah, woohoo, let's do that. And then horses usually have a nice reputation now for these services. So a lot of people have heard of it. They just don't usually know a lot more about it. So that could be the draw, but people come because they want to feel better, do better, learn something new, and so if we're clear in the beginning on our websites and advertisements, like what you can expect, then you're setting that person up legally and ethically. When, I mean, I don't know how many people have signed up for something and it wasn't what they thought it was, and how upset they might become or how much money they paid into that. And they're like, what?
Right. Yeah. So, yeah, in both spheres, I think whether it's learning, coaching, or psychotherapy, you bring up a great point of just really being, making sure that the client is resourced and that the benefit is hopefully at some point achieved. Do you have time for the third question? Okay. So the other one was, I'm wondering if you can share an experience or some kind of anecdote, whether as a therapist or a horsewoman, it doesn't really matter, when you either experienced in yourself or you saw someone experience, some kind of significant transformation.
Mm-hmm. Yeah, so I thought about this question, and I have seen several clients have really powerful moments and experience and definitely do better. So I'll say that. But when it comes to like a story, I was actually going to bring in my experience that I actually had recently that I think might help answer the question and tie into why horses are effing amazing. and no matter how old you are, you can still learn and connect and grow. And horses are great facilitators for that. And so currently I have a lovely horse that I'm leasing, and her name is Autumn. And I'm full care leasing her, and she's a 20-year-old half Belgian, half quarter horse mare. And I knew of her and like kind of met her around August, September, fallish, and I didn't think anything of her. I'm like, oh, okay, there's another horse. Nice. So in October 13th, 2023, we lost a therapy horse named Dancer. And she was a lovely paint mare. She was old. She was my first therapy horse that I worked with, and then my nonprofit. And I currently lease use horses at a lovely private property barn in Sherwood, Oregon. And I started actually working there with clients in February 2022. And Dancer was the first horse I could use right away because she was very safe and reliable and just a lovely mare. And I really connected with her in a way. But she ended up having to be euthanized because of just severe arthritis and ring bone and just in pain a lot. And the pain management medication wasn't enough anymore. So we let her go. And that was really hard. That impacted me pretty hard. And I hadn't, as like a leader of an equine program, I haven't experienced that before where I lost my therapy horse. I've experienced loss of therapy horses when I've worked at other nonprofits before. So this is different. This was like, wow, I had to go through the process of like making sure my clients that worked with her for years had their opportunity to say goodbye and all of that. So it was really hard. And then right after that, just a couple of days later, after Dancer was let go and went over the rainbow into horse heaven, Autumn came back to the property, and she was put in Dancer's pasture. And the day that I arrived, and there was Autumn again, and she came right up to me. Something happened, and I'm starting to get the chills as I talk about it. Something happened to where she comes up. She's very sweet. She's a big girl. She has a big head, but she's mostly considerate with it. And she comes up and she's just like staring into my eyes, and I'm like petting her. And like I felt my heart just like open. It was like that normal barrier that you might have when you're interacting in public or whatever is kind of like level sealed, unless you're with trusted people or it's appropriate to open that space. And she just blew that wide open, and something happened to where I felt this deep connection with her from like my spirit level coming through to her. And it felt like she was doing the same back. Like I felt I could hear her intuitively, like something was there. And it was like the energy of like, hi, I really like you. Oh, I really like you too. Oh, you're cool. I want to be friends. Let's be friends. But there's something like that kind of like, I mean, I'm like, improving that last part there, but it was so powerful and hard to describe. And it was like, I fell in love. It was like being in love with that kind of feeling. And I understand, I'll say this, like, I think humans have a little bit of a fantasy ego sometimes where like we love a horse. Oh, I love that horse. But the horse may not really like us that much back. It's just how we do that sometimes, right? Or we're like, oh, he loves me, right? But it happens, right? I mean, there's nothing wrong with that, but it may not really genuinely be reciprocal.
Right.
And I just want to say that because we put a lot of anthropocentrization on horses and stuff, with our human stuff onto them. But I really feel like, and I have feedback from my interns and other people that have said there is something there. Like she totally likes you. Like there is something there. So it wasn't all just in my ego head. And so what's happened since then is like every time I see her, the same thing happens. My heart opens. I feel calm. I'm just like I'm genuinely, authentically me in that moment with her. Wow. And I have this, altruistic feeling. I want to give that back to her. So like I want her to feel my healing energy. Well, she gives me her healing energy, if that makes sense. It's really lovely. And there was one day in particular that I was there cleaning out her stall, and it was just her and I. I think it was like an off therapy day. And I guess I was carrying stuff, like carrying emotional stuff or stress or whatever. And she came up behind me. And the thing with her, too, is that even though she's a big horse, I trust her to not hurt me at all. Like, and even though I have years of horse experience, there are times horses still scare the shit out of me, or like I get anxious around horses that I don't know, just because of the risk of unpredictability of spooking one, and then you don't know how they're going to interact with you. They can try to kick you. There's always that stuff that can come in. But with her, it's like she could be in my space, and I knew she wasn't going to hurt me. So I was just cleaning her stall, and she like comes up behind me, like right here, and I feel like the back part of me like open, kind of like Sarah said this,
Oh,
my
wow.
heart opened this way, like this back part opened this way. And I felt like this emotional, energetic release, almost like you turn the faucet on and this water just kind of comes out. It's kind of like that. And I was like, what is she doing back there? And she kind of touched me a little bit, but didn't really have to. And I felt her just like presence. And then I start crying. I start crying. I was like, okay, I don't know why I'm crying, but I'm crying. Okay, I'm crying. And it just like came through, it came out. And then it maybe lasted maybe like probably only a minute. It felt a little longer. And then she stopped whatever she was doing. And I was just like, whoa. And then after that, I felt like super light. And like it was so cool. And I turned around and thanked her and was just like, thank you so much, baby girl, and all of that. So there's something about her that, and I'll say this, like there are many horses in my lifetime since I've interacted with them since like, 7 years old, that I love, right? Or I get crushes on, or I'm like, you're the best and you're going to be mine someday, but with her, and I'm 40 years old now, she's the first horse that I feel like is mine. Like I've never actually owned a horse before. But I want to be able to own her. I just can't afford her, and we don't have enough money in the nonprofit to purchase her yet. But we do have enough to full care lease for her, and I love doing that. And I love being able to provide for her and give her a nice life and all of that. So my hope is that there's a big fundraiser coming up in May, Seen Through Horses campaign, where it's the month of May is all about mental health awareness. And it's an opportunity for fundraising to try to bring in dollars. And I'm hoping that through that endeavor, I might get enough to be able to purchase her. And I think her asking price at the moment is like $2,300 or something like that. And then I also want to make sure we have a cushion for if there's any veterinary issues,
Right.
Her general veterinary care. Fortunately, she's very healthy and very sound for her age. She's an easy keeper, but still, want to be mindful of that and have savings in case something does happen to her, and be able to, cover her care and board as well. And then I also want to be able to do training with her because she's still green when it comes to horseback riding, like I'm actually riding her. I think she has wonderful potential to be able to do mounted sessions with clients. And I'm trained and qualified in both. So with clients, I'm able to do unmounted work and mounted work. I'm a past certified therapeutic riding instructor and also equine specialist health and learning and all of that. And at the moment, I've been training her in unmounted sessions, and she's doing lovely with that. Like she's so smart and does really well with that. But I'm not a horse trainer, and I want to be able to get some of the help with really good groundwork with her and help her get comfortable. I think it's gonna be just kind of like a retune up from the ground up to get her used to riding again, because she's been ridden. She's just out of shape, and I want to do it right by her, and I want her to enjoy the process. But she does get as wonderful as I just described her. She's a horse. She has her own horse person in there, and she does get anxious and she does get worried. And especially when she doesn't understand something or she realizes we're going to ask her to do something, and her anxiety spikes and she gets worried. She's not necessarily unsafe with it, but her way that she manages it is to try to come in close and not run away, right? She's like, I'm scared I'm
Right.
coming into you because she trusts me, right? We're like, we were bonded, right? So she's like, you're my person. And I'm like, girl, you're huge. So I'm like, back off, girl. So I want to like train her right, if that makes sense. And I would love to find a trainer in our area, in the Oregon area, that I don't even know if this is really a term, but that like would do like connection based
Mm-hmm.
training with her that's like, you know, has a boundary with her, right? Of course, not just like open ended, but like has a boundary with her, but recognizes her anxiety signs and like works with her on that. I don't want to just run her through it. For example, there's a lot of training methods that you just exhaust the horse, they'll be fine. It's like that. I mean, that's okay, but I want her to be able to like learn how to manage her own anxiety through
Yeah.
her confidence and understanding, if that makes sense. And she's really smart. So she learns and she understands, and a lot of the anxiety is her own horse perfectionism. Like she wants, I just what I believe, and what I'm picking up on from her is it's more like performance anxiety. Like she's really anxious to please, and because she doesn't quite understand what's going on, or she might have a little mare sass to her, like I don't want to do that, make me. Then that happens. So yeah, I'm gonna pause for a minute. I know that was a really long story, but do you have
Yeah.
any
No,
questions or
that's great.
need to clarify anything?
And she really, and I know we talked about this about training, and I did reach out to Kathy and Shelly, and they don't know anybody in the Oregon area. I have a mare like that, actually. You're almost describing Bella. And it's taken a long time, for that trust to be there. I have absolutely no idea how she would be with clients. In a reflective session, I think she'd be fine. If she's asked to be moved, and do something, I'm not quite sure. But yeah, I've been doing herbs with her as well, and that has really been helpful. Yeah, I think you sent me a picture of Autumn. Is she like a big Palomino? Yes.
Yes, yes. She's like a Barbie horse.
Yeah.
Yeah,
Well,
she's a
it sounds
beautiful
from,
neck, like an
yeah.
illusion. It's like a Belgian neck, but it's so pretty, and she's got a lot of mane, a lot of
Yeah, she has a
tail.
beautiful mane. I remember that. And
And she has dapples, which is cool. So even though she has the flaxen mane and tail kind of thing, she has, and then more of like the golden body. She has dapples. Really cute.
oh, she has freckles.
She does. Yeah, they're beautiful. They're all over her whole body. These little
And it
white
sounds from
dapples
what you
everywhere.
described that she almost has this ability to clear.
Yes, and that's the thing that was interesting is that our connection is both utility based, like yes,
Mhm.
I mean, I this is my joke. Hope it doesn't offend anybody, but she needs to work for her keep,
Exactly.
so to speak, right? Like just like work the corner. Like you need to bring in the dollars. And so I was and I've assessed and evaluated horses for in the past for appropriate fit. Empath International is a really great guide on that. And like, how do you know if a horse is appropriate for therapy and all of that? And she fits the bill for it completely, and the best part is she's like a Miss Congeniality. She likes people. She loves people. She likes to interact, and that's what you really want in
Right.
any equine therapy horse. You want them to like people. And she is understanding her role and like what she's doing more, and she's doing really well with that. I think what's nice with her is that I think once she understands what's going on, and like gets the muscle memory back, and understands there's not going to be any pain to her at all. Like it's the best of our ability. We're going to make sure she's going to be safe. I think she'll catch on pretty fast too.
Yeah.
So it's not really, I say starting from the groundwork up because I feel like that's an appropriate thing to do versus saddle down.
Hmm.
I just feel like she needs to be conditioned, she needs to be worked at, get her top line and everything. There are two world renowned trainers that I love that I would love to see if there's somebody that's trained with them before. And one is Warwick Schiller, and the other is Mark Ratchet or Rashid. Both have just such a nice approach to working with horses from the ground up. And so I will definitely take any recommendations though. Yeah. And then hopefully they train me on what to do. So, because I've lunged horses and I've worked with horses before, right? But like, I want to make sure I do it right. I don't want to
Yeah.
or get
And,
hurt or her to get hurt.
they all have their personalities. There may just be that little part of her that is anxious and, that anxiety just gets triggered. And, well, I hope this has been fun. It's certainly been so much fun for me.
Yeah. Thank you so much for this opportunity and for hearing my story. I love being able to talk about this stuff. I could talk about all day long.